Good morning. It's January 30th, and this is your daily brief in science. Here's everything you need to know. The FDA has approved semaglutide, known as Ozempic, to help reduce the risks of worsening kidney disease and cardiovascular death in adults with type 2 diabetes and chronic kidney disease. This decision comes after a pivotal clinical trial that began in 2019, which involved around 3,500 participants across 28 countries and lasted an average of 3.5 years. The late-stage trial demonstrated that Ozempic lowered the risk of kidney disease progression and related death by 24% compared to a placebo. With this new approval, Ozempic becomes the most broadly indicated drug in its class, allowing treatment across a wider range of medical conditions. Ozempic, alongside Wegovy, belongs to a category of medications called GLP-1 agonists, which mimic a gut hormone that regulates blood sugar and appetite, thus aiding in the treatment of diabetes and obesity. Experts, including Dr. Richard E. Pratley, express optimism that this new treatment option will significantly benefit patients with both type 2 diabetes and chronic kidney disease, addressing a critical healthcare need. Chronic kidney disease is a common complication of type 2 diabetes, affecting about 40% of T2D patients and posing significant cardiovascular risks. The demand for Ozempic has surged due to its weight loss benefits, leading to previous shortages. However, the FDA has confirmed its availability. Novo Nordisk is continuing research to explore how semaglutide impacts kidney disease progression, building on the positive outcomes already observed. Public sentiment indicates that around half of U.S. adults support the use of weight loss drugs for obesity treatment and favor coverage for these prescriptions under Medicare and Medicaid. While Ozempic offers significant benefits, it may also cause serious side effects, including thyroid tumors and pancreatitis, and is contraindicated for individuals with certain family medical histories. A groundbreaking NHS trial is set to investigate blood tests for early dementia diagnosis, a critical step in addressing memory loss issues. Known as the Blood Biomarker Challenge, this study will involve 3,100 participants and has a budget of £10 million, funded by the People's Postcode Lottery. Led by Professor Vanessa Raymont from the University of Oxford, the research aims to develop a reliable and cost-effective blood test for clinical use within 5 years. Professor Raymont highlights the urgent need for improved diagnostic methods to ensure patients can access new Alzheimer's drugs as they become available. Currently, only 2% of Alzheimer's disease patients receive a proper diagnosis, primarily due to limited access to specialized PET scanners and trained personnel for spinal fluid sampling. Dementia remains the leading cause of death in the UK, and patients often face long waits for diagnosis, which emphasizes the importance of this research. The study plans to include a diverse participant demographic, focusing on minority ethnic groups, elderly individuals, and those with other health conditions. Early diagnosis through blood testing could significantly enhance patient outcomes by enabling timely management of the disease and delaying its progression. The trial is being conducted across 28 sites in the UK, examining various types of dementia, including Alzheimer's, vascular, and Lewy body dementia. Experts, including Professor Fiona Carragher and Dr. Shiona Scales, express optimism about the trial's potential to revolutionize dementia diagnostics. With new drugs for dementia in development, early diagnosis is crucial for patients to benefit from these treatments once they become available. Participants like 67-year-old Stephanie Everill, who has mild cognitive impairment, hope that the trial will lead to faster diagnoses and better access to treatments. A recent study published in Nature reveals a significant advancement in cardiac treatment through the development of a lab-grown heart muscle patch. This innovative patch, derived from induced pluripotent stem cells, has shown promise in enhancing heart function in both monkeys and a human heart transplant patient. Traditional treatments for heart failure primarily aim to slow the progression of the disease, often leaving patients with limited options for restoring heart function. The heart patch, while not designed to replace transplants, represents a new treatment avenue, particularly for patients in palliative care, who face a 50% mortality rate within a year. The research findings suggest a new approach to treating heart failure, potentially improving outcomes for patients with severe cardiac conditions. Researchers are hopeful that the heart patch could delay the necessity for heart pumps or transplants, although the long-term effects of this treatment remain unknown. Currently, the patch is undergoing testing in a small group of human patients, with initial results indicating potential benefits for those suffering from advanced heart failure. Each engineered patch contains approximately 200 million cells embedded in collagen hydrogel, which have shown the ability to enhance heart function while avoiding tumor growth. The implantation of these engineered heart muscle patches aims to achieve sustainable engraftment of heart muscle cells, known as cardiomyocytes, onto the heart's surface. A late-stage clinical trial in Germany, led by the University Medical Center Göttingen and University Medical Center Schleswig-Holstein, has enrolled 15 individuals with advanced heart failure. Heart failure occurs when the heart cannot pump enough blood to meet the body's needs, often due to damage from a heart attack. The stem cells used for these patches are sourced from a general pool rather than from individual patients, which helps to reduce preparation time and the risk of immune rejection. Richard Lee, a Harvard cardiologist, acknowledged the study as a significant achievement, but stressed the necessity for further research before widespread clinical application. Researchers at Penn State University have unveiled a groundbreaking method to study honeybee movement by affixing tiny QR codes, smaller than a pinky nail, to the backs of around 32,000 bees. This innovative automated imaging system continuously monitors the bees' movements, enabling researchers to track individual bees as they leave and return to the hive. Preliminary findings from this study indicate that most foraging trips are brief, typically lasting under 5 minutes, although some bees can venture out for as long as 2 hours. Study co-author Margarita Lopez Uribe highlighted that during these longer journeys, some bees may explore further afield and may not return to the colony. The research suggests that placing hives in areas abundant with high-quality food sources can effectively limit the bees' foraging range, a strategy that could benefit beekeepers. This new tracking method aims to replace traditional fieldwork that relies on limited human observations, making the study replicable across various landscapes. To ensure the safety of the bees, researchers used a minimal amount of non-toxic superglue to attach the tags and managed to keep the bees still by temporarily cooling them. Contrary to the common belief that bees live around 28 days, the data indicates that they can forage for up to 6 weeks, suggesting longer lifespans than previously understood. Ultimately, this research aims to enhance organic beekeeping standards in the U.S., offering valuable insights for both scientists and beekeepers. This study is part of a larger project that will also investigate the foraging distances of bees using radar technology and transponders. The overarching goal is to determine how far bees travel from their hives for foraging, contributing to a deeper understanding of their travel and feeding patterns, which are crucial for agricultural systems. The findings from this research were published in the journal Hardware X, showcasing a collaborative effort among biologists, entomologists, and engineers. Recent genomic analyses reveal that bats possess remarkable adaptations in their immune systems, significantly enhancing their resistance to viral diseases. These unique adaptations are evident in the enrichment of positively selected genes related to immune processes when compared to other mammalian orders. Unlike humans, infections in bats are predominantly asymptomatic, with their immune responses effectively limiting inflammation and tissue damage during viral infections. Bats are known to serve as natural reservoirs for various viruses, including coronaviruses, which pose zoonotic risks to humans. Coronaviruses are particularly prevalent among bats, identified in 15 out of 21 bat families, with the Rhinolophidae and Hippoceridae families showing significant numbers. In total, viruses from 31 families, including coronaviruses, paramyxoviruses, and filoviruses, have been detected in bat populations. The Bat1K project has made significant strides in understanding bat genomics by sequencing 10 new reference-quality bat genomes, particularly focusing on species from Southeast Asia, a region recognized for its zoonotic disease hotspots. Despite being natural reservoirs for deadly viruses such as Ebola and Nipah, bats remain largely unaffected by these pathogens. The findings from these studies provide valuable insights that could guide future research on viral tolerance and disease resistance in other species, including humans. For decades, scientists have been intrigued by how bats can carry lethal viruses without suffering from associated diseases. Among the viral sequences detected in bats, coronaviruses account for 17.8%, a stark contrast to the mere 1.4% found in rodents, highlighting bats' rich viral diversity. Notably, a deletion of a conserved cysteine residue in the ISG15 protein in certain bat families may enhance antiviral responses and ISG ylation, impacting their viral defense mechanisms. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.